Surgeons have praised the pioneering use of robots in saving a record number of men from one of the UK's deadliest cancers. The £1 million machines, known as Vinci robots, have performed life-saving surgery at University College London hospitals on more than 500 men with advanced prostate cancer. Surgeons credit them with being quicker, safer, and the procedures have fewer side effects than existing treatments, in a move that has been described as a game changer. The robot, controlled by a surgeon at a computer console, has 6 arms with tiny scissors and pliers, which make incisions in the patient's abdomen. They are able to remove small sections of tissue and glands affected by the cancer without making a large cut, as in open surgery. This means the patient recovers much more quickly and can go home the next day, unlike conventional surgery, where patients can remain in hospital for 5 days or longer. Furthermore, as the robot is so precise, it is less likely to damage surrounding tissue. This means that men are much less likely to suffer common side effects such as incontinence and impotence. Prostate cancer is the most common form of the disease in men, and 1 in 8 will develop it at some point during their lifetime. Many men delay prostate cancer treatment over fears they may suffer incurable erectile dysfunction and urinary incontinence, and it is very difficult to predict whether the tumours are aggressive and deadly or slow-growing and relatively harmless. Prostate cancer is the most common form of the disease in men, and the second biggest killer in men after lung cancer, causing 11,300 UK deaths a year. It gives men their lives back after prostate cancer. Professor John Kelly, clinical lead for urology at University College London Hospitals at Westmoreland Street Hospital, said, "Although conventional surgery removes their cancerous tumour, patients are left with life-changing after effects like incontinence and impotence, which can be devastating." Robotic surgery has changed that it gives us the precision to remove the cancerous tumour, preserving the tissues and functions around it. It gives men their lives back after prostate cancer. Patient can go home the next day. The number of operations carried out by UCLH is expected to exceed 600 by the end of the year, the most ever performed by an NHS hospital in a year. Two Vinci robots are currently available and in use 6 days a week. Westmoreland Street Hospital performs prostate surgery previously carried out at hospitals including Whipps Cross, Homerton, North Middlesex, Queen's and Romford and Princess Alexandra in Harlow as part of the NHS' move to promote optimal cancer care. Patients are able to go home the next day, rather than spending 18 days in hospital following conventional surgery. The latest Vinci Xi robot has been in use in several London hospitals, including the Royal Marsden and Guy's, since 2015. prostate cancer sufferer David Ferris, 66, an activist and political researcher, underwent the robot-controlled surgery, which first involved him having an MRI scan ahead of a biopsy. The painful biopsy, which involves inserting a needle into the prostate to collect cells, can therefore be performed more accurately. Mr. Ferris opted to have his prostate removed around 6 months ago after his previously slow-growing cancer from 2 years ago starting becoming more aggressive. The operation was successful and Mr. Ferris is heading home today, the Evening Standard reported. How does the robot work? Speaking to Mail Online, Dr. Greg Shaw, a consultant at UCLH, explained how the Da Vinci robot works. He said, "The Da Vinci robot operates through what we call a master-slave system, in which the surgeon drives the robot while comfortably sat in a seat. It emulates the surgeon's movements, so if he moves his hand, the robot moves in the same way. You can have graspers or scissors that open and close with the same degree of freedom as the human hand. The robot has 3 arms with different instruments, and the surgeon can choose which two to operate at any one time. It is also equipped with a camera with 10 times magnification and 3D vision that goes inside the patient, allowing the surgeon to see precisely what he or she is doing. Dr. Shaw explained, "It's basically keyhole surgery, in that the instruments pass through little cuts in the abdomen wall, but it's much more precise with a wider range of movements." While prostate surgery used to take 3 hours, this time is cut down to just 90 minutes with the Da Vinci robot. Dr. Shaw explained, "With the robot, there's less blood loss, so your surgical view is better. The surgeon can also choose the optimal position without having to move from his seat."